Think Pink, a Family Matters breast cancer special, is made possible by the following partner.
Providence Health and Services has served Northwest communities for more than 150 years. With compassion and excellence, Providence cares for all, especially the poor and vulnerable. At Providence, we're simply dedicated to your good health.
Think Pink, a Family Matters breast cancer special.
Hello, I'm K2's Deborah Knapp, and welcome to Think Pink. Breast cancer is a leading threat to women's lives here in the Northwest. Portland is a world leader when it comes to the effort to prevent and eradicate the disease. In the next half hour, we'll meet everyday people who are leading exceptional lives, working to beat this deadly disease in different ways. From advances in surgeries to breakthroughs in treatment, the fight for a cure is powered by multiple resources. One of them a way for patients and doctors to explore new possibilities.
I was diagnosed with invasive lobular carcinoma March 29th of last year. Less common form of breast cancer that is often undetected by our current imaging technology, which unfortunately means it's usually later stage at diagnosis, which was true for me. I had stage 3 breast cancer. I had surgery first, actually, because at the time we did not know the full extent of my disease, and then I was heading, next step for me would be chemotherapy. And with Allison, we were in consultation about what that treatment protocol would be, and I knew she would advocate for and recommend clinical trials, and she did.
Clinical trials or research studies or clinical studies, there's a few names for them, are ways that people or patients are able to participate and get new treatments or try new therapies to see what should be the new standard of care. Almost always we're doing a clinical study because we have a question. What I like to tell my patients is the reason I know that surgery is good for breast cancer, the reason I know that you should take this pill or this drug is because some woman or some person participated in a clinical trial in the past.
And there was a clinical trial available at the time by the name of ECOG 5103, a mouthful. But it was actually a trial testing the efficacy of a drug that's produced by a company here in our own backyard, Avastin by Genentech. And it was added to my chemotherapy protocol. So you have the standard IV and the standard drugs, and then another bag was added. So it took another hour or so on each treatment cycle. And at the time, you don't know whether you're getting the drug or getting placebo.
I will say that adult cancer patients don't participate in as many clinical trials as we'd like. When we think about the children's oncology programs, they tend to have very high participation rates of children in oncology clinical trials, and that's why we've had such amazing advances in treatments for instance, childhood leukemia. However, adult cancer patients, it's somewhere on the order of 2 to 3% of adult cancer patients go on clinical studies. And really probably upwards of 50 to 60% of patients would be eligible.
I believe I have a responsibility to contribute to find a cure if I can. And second, I wanted to be or have access to drugs that might not be available in the open market if they weren't currently approved treatments. And then third, I never wanted to look back and think with regret that I didn't do everything I possibly could to beat this disease.
Every life, every person who's had a cancer diagnosis is touched by someone who participated in a clinical trial in the past.
There are just wicked smart people, Allie Conlon, in that company that all over the world that are committing their lives to trying to save us. And I think I want to be a partner to that, and I want to be in that fight with them.
When a patient ends their treatment, the road ahead may seem unclear. We found a place that helps with the transition from patient to life as a survivor.
I was diagnosed on July 17th of 2009, and it was breast cancer. I had a body scan. I'd had an abnormal ovary. They did a ultrasound and then an ultimate surgery and found out that it was ovarian cancer as well. You are thrust into another world, basically, that you know nothing about.
The Survivor Clinic is a service that we provide to patients who who have recently completed therapy, and we aim to counsel them on what late effects they might expect, assess what acute effects they're having, and make appropriate referrals for services that they might need.
Your whole focus was on what you were going through and the cancer, and you knew you could get answers to questions immediately. But then it stops.
They have told me that they felt like when they were in treatment, they were doing something, doing something to fight the cancer, and they were well monitored, very frequent appointments. And then when they were finished, all of that kind of ended, and what do I do now? I'm not doing anything. There's got to be something that I can do.
For me, the Survivor Clinic was a place where I could go that I felt I could spend time. I knew I had, I think the appointment was about an hour and a half. Everything I wanted to know, there was an answer for, or she could give me the name or a brochure about where I could get the answer.
We create a wellness plan for each person, and part of that is connecting them with their primary care provider. And it outlines for them, who is responsible for doing future screenings, whether it's on the oncologist or the primary care provider. So it lets everyone know these are the things that need to be done, and this is who is going to be responsible for that.
This is it. I mean, this is my roadmap. It tells me when to do what. It has everything. I mean, it is. Otherwise, I think you could hear about it here and there. You could research it. There's certainly not a lack of cancer clinics and cancer support groups. That's not the issue. But I think to be able to sit down and have somebody put it together in a package for you, that this is actually tailored to me, I think that's really important. I mean, I can't even say how important it is. I think you have a million questions that you realize aren't answered. I'm not the only one that's walking out of cancer treatment and wondering what you should feel like, what to do, what goes on now that you're supposedly, healthy.
For more information on the Survivors Clinic, just head to the Family Matters section at katu.com and click on the Think Pink icon.
My mom.
My best friend.
My father.
My grandfather.
My brother.
Me.
Eventually, cancer touches all our lives. We designed the new Providence Cancer Center to make life easier, should it ever touch yours. Providence Cancer Center. We're all about you.
Each week, 51 women in Oregon will be diagnosed with breast cancer. Until no one fears the diagnosis of breast cancer, we still have a lot of work to do. Join the 20th annual Portland Race for the Cure. Go to katu.com to register and donate.
The biggest families of food that have been implicated in cancer in general and breast cancer specifically are sugars, especially probably the fructose-containing sugars, and processed meats, preserved meats. So things like lunch meats, bacon, ham, cured sausages. And so we really recommend that people read the labels very, very carefully. And we would argue that if you aren't reading the labels carefully, you're not going to be able to eat well. This actually is the core diet we would use for people going through surgery or radiation or chemotherapy, because what we want to do is have plenty of protein in order to have good tissue repair, and plenty of the vegetable materials, of which beans and vegetables are the best examples. But there are some foods that really stand out, and among them, for example, are nuts, and walnuts in particular have been found to be helpful. 2 handfuls of walnuts a day appears to have an anti-cancer effect. Other foods have been more controversial. We have soybeans here. Soybeans appear in the most recent studies to actually improve outcomes and help prevent breast cancer. And so we recommend whole soy products, although we do not recommend the highly refined soy extracts. In addition, we have some flax seeds here. And they also, in human studies, appear to reduce the chance that the cancer is going to grow. So it helps suppress. None of these things are going to be cures for cancer by themselves, but in total they seem to suppress the growth of cancer and improve survival. Other foods that stand out in the whole cancer literature are berries, of which blueberries are a local and well-known example. We have evidence that fish oils seem to suppress the proliferation of breast cancer as well. And a common example of how to get fish oil is simply to eat more oily fish, of which tuna is an example. Sardines are a superb example, and often for those who don't like sardines, they can mix the sardines with a little bit of tuna, or a lot of tuna, dilute the sardine, and they won't even know that they're having sardines. It's a way to trick your family. Good oils make a difference. So here's an example of olive oil, which has the best data currently. Other vegetable oils, there's actually some concerning data that they actually may help the proliferation of the breast cancer, where things like fish oils and olive oils seem to suppress the cancer. So we don't recommend a low-fat diet, but we recommend a good fat diet.
It's one of the most important things a woman can do in the early detection of breast cancer, and yet every year, thousands of women put it off. No matter the reason or the myths, a mammogram is crucial in the fight.
My mom had breast cancer and she passed away. She waited too long. She actually felt a lump and didn't even go for some period of time, and when she went, it was actually too late, and she went right into mastectomy and chemo and radiation. My mom waited because, first of all, she probably didn't think that's really what it was, and that's just the kind of personality she had, to pretend that it wasn't happening. And then when she did go, finally, because it actually was painful.
A mammogram is looking for early detection of breast cancer. Breast cancer found early with mammography is curable. We have patients that come in all the time that have not had a mammogram, and I feel it's very easy. It's a pretty quick procedure.
You remove part of your clothing so that you can put your breast on the machine, and there are 2 plates, and one of the plates comes down. It presses, but it's not painful. It doesn't press so hard that you hurt. Then they do a couple of different views on each side, and then they review it after that, and it's very simple, and it's not painful, it's not stressful. It's less stressful than going to the dentist.
The mammographer looks at the image after we take the picture, and then the radiologist will look at the whole case after we're done.
They actually started recommending them the mammogram in my 40s just as preventative, and so I was all for it. I did want to know ahead of time. My mom found out that she had breast cancer when she was in her early 50s, and she passed away at 55, and this is the year that I turned 55, and so it's been on my mind, and I was just thinking lately, you know, here I am at the same age that she passed away and was fighting cancer before that, and I'm playing, you know, kayaking outdoors, having fun at 55, and she was already at the end of her life. And so every day is like a gift now.
We have an obligation to improve the state of the art. Within the Providence Cancer Center, I know we have the best people providing the best care with the best technology, with a focus on the entire patient and their family to help them achieve the best outcome.
Providence Cancer Center. We're all about you.
I see already the beginning of a revolution in how we treat patients with cancer.
I was diagnosed with an aggressive breast cancer. I just thought, I can't leave my boys. Today, I'm cancer-free. The research that Komen helped fund saved my life. I'm living proof that your donations make a difference.
One year ago, they touched so many with their personal stories of courage in the face of breast cancer. Tonight, we check in to see how far they've come.
Couple days towards the end were actually dreaded going because I know it would make me feel worse, but it was okay. The people who work there were amazing.
Love you too. Thanks for taking such good care of me.
And so to come out and see the finish line ribbon was just amazing. It was great. I walked with not only my mom, but my family and friends joined me this year, so we had a group. And a little emotional as you cross the finish line, but overall it was amazing to see there's lots of pink out there. Actually, the first time that I ran, we'll call it a jog, is I kicked off my Hood to Coast team at Hood to Coast last year, really in honor of my best friend who died of cancer. And she ran leg one 19 years, so I walked, jogged leg one for her and for me, and it felt great. It was a lot harder than I thought it would be. I hired my running coach that I had years ago, and after all the, what he calls trauma to my body, we started slow, 5 minutes running, 5 minutes walking. And I gradually built up over months, dropping a minute of the walking, adding running, till now I'm running 12 miles on a long run and running about 5 days a week. I would say if you asked me 6 months ago, I was more defined by it. And now I think it was something I went through, and it was an experience. Certainly not fun, but I learned a lot. And now I would say that I'm good, I'm doing good. My new normal is it's progressed from having it in the forefront of my mind every day, that now that I think about it occasionally, I don't focus on it. Tried to move on. The experience overall, I feel very blessed. Life is good and back to life.
Something happens to you when you're diagnosed with this disease, and you become the strong part of you that sometimes you didn't even know you had comes right out and says, that's it, we're gonna fight it, we're gonna do it. And I'm not saying that that's the case for everybody, but I'm 32 years old. I want 32 more, and I want 32 after that. And it's not, I don't think that, a speed bump in the road is gonna stop that. I think you have to have hope.
It is with great joy that I now pronounce you as husband and wife. Paul, you may kiss Erin for the first time as your wife.
It was really this celebration, and to be able to tell him what an amazing person I think he is and how incredibly lucky I feel to be with him. I was really emotional at seeing myself because I had been bald and looked really sick for a year and almost 2 years. And I was really excited to see myself looking so much like the way I did before I was sick, and to be able to see myself in a way that if people passed me on the street, nobody would have any idea. After the wedding, I came home, I started chemo the following day. When I first was diagnosed, I think I was a lot more fearful that I didn't have any control over the situation, or I didn't have any power in getting better. And that's just simply not true. I have a ton of control over it and a ton of power to change the way I live so that I feel better through treatment. I think I was changing, I was in a kind of transitional time, and I decided to change treatment with that transition. It has turned out to be a really great fit, and I have a great relationship with my doctor, who is really aggressive and as horrified that I have cancer as I am, and wants to beat it as much as I do, and I feel much more of a team partnership in that way. Here we are. I am having it's called a modified radical mastectomy, which just means that it includes the lymph nodes underneath my armpit. The purpose is that we are essentially taking out the mothership. In conversations with my doctor and my surgeon, they thought that if the mothership was gone, it was the best chance of having little to no reoccurrence. So we'll do the surgery today, and then in a month I'll start some radiation, and I'll do that for 6 weeks. And then when the radiation's over, I'll do 3 more months of chemo, and then hopefully I will be good. We've been kind of learning as we go, and just doing what people told us to do, and learning how to really interpret when you feel like something is wrong and what to do about that. And when we started to feel like something was wrong, we switched doctors and found a really great path and partnership with our doctor. So I think that, we talk all the time about how it was one phone call. One phone call changed all of that for us. We just simply called another doctor who wanted to give me a shot. And I knew that
If I was given the shot, I was going to take advantage of it. If you start to feel like things are wrong, if you start to feel like people are telling you things that don't make sense to you or that you don't agree with, go find somebody else. It doesn't ever hurt to ask somebody else. All they can do is give you another opinion. And it just so happened that I liked the one I heard.
We actually both said in our vows that is really important to me and remains important to me is that, you know, from day one, we decided we were going to do this as a team. And whatever happens, we can do it as long as we stick together. And however hard it gets, we're going to do it together.
When I found out I had cancer, the first thing I needed was reassurance. I needed to know that everything and everyone I needed to help me fight this cancer was right here. There wouldn't be anywhere else I'd want to be.
Providence Cancer Center. We're all about you.
It is a center of hope.
Portland's Susan G. Komen Race for the Cure is one of the largest breast cancer events in the world. But there was a time when neither the race nor Komen existed here locally. Not until 3 women brought their unique strengths together to create one of the strongest affiliates in Komen history.
Hi, Chris. Oh, it's so good to see you. We have to get together more often than this.
We're all 3, of course, breast cancer survivors, so we were passionate about wanting to do something to help others. And I was diagnosed with breast cancer in 1986. I was 34.
I actually discovered it through self-breast exam. At that time, they didn't think it was breast cancer because I didn't have a family history.
I had late detection. I didn't know the right questions and how to persevere in a concern that I had.
A friend actually told me when I explained to her that I wanted to somehow create a fundraiser to provide the funds for women to get free mammograms. She told me about another woman in the city, Lolly Champion, that was in process of bringing this thing called the Race for the Cure to Portland.
When I found out about Nancy Brinker's book about the Race for the Cure and her work to educate people, that seemed like a ready way to begin working to do something that I felt very strongly about, and that was to educate women about the risks and early detection for breast cancer. And called and said, hi, I live in a state where we make running shoes, and I think that we should have a race for the cure. I just remember the long silence when the woman with a very Texas accent says, well, there's a little more to it than that, and I think maybe you should come back to one of our affiliates meetings and find out more about it.
It wasn't until we contacted an event company that we had any idea what was involved in creating a new race in the city of Portland, because none of us knew anything about it.
First time race, especially since you're limiting to women the first time, you'll be lucky if you get 800. That was just kind of a statistic that the Hamilton event felt that they knew from organizing races throughout Oregon, particularly in the greater metropolitan area. He said, I just think you need to be realistic.
It took us 6 to 9 months to manually go out and tell people and get our brochures into storefront windows.
And I remember the first week after we passed them out, it was like, oh my God, we could not believe how many race brochures we were already getting back in, and we had to keep increasing the t-shirt production. And it was a wonderful problem to have.
6,800 people showed up that first race, and they were expecting, anywhere between 800 and 1,000. And it was just overwhelming. It was so joyous.
I think we were amazed that as many people showed up as were there. It was very exhilarating, and glad to see that our community would draw together for something like that.
And that's where the first time it really hit so many of us. the nerve that we'd struck, because so many people came in to buy the t-shirts to give money saying how breast cancer had affected their lives.
800 mammograms were provided for the first, after the first Race for the Cure.
Our first intent was to educate and give free mammograms. The race was truly very secondary for the three of us. It was a means to an end.
It was always, let's work at in whatever capacity we can to find a cure, and that does involve money, and that does involve research, and it involves awareness. It involves women getting out there and getting screened early and being proactive and asking questions.
And that's why I believe that Raylene and Chris and I came together in such a sisterhood, because our strengths were that way, but we also had the type of community that was willing to embrace that.
I wanted our particular affiliate to have the opportunity another time during the year to have a way to educate the public besides the Race for the Cure. And so we started the Breast Cancer Issues Conference in 1996.
The second year, the program grew beyond my expectations, and it has exponentially grown and developed into something that I would have never expected in my wildest dreams.
Started as a total volunteer group and into a very well-run organization that has great leadership. I'm very proud of that leadership and the people that are involved in it now, and sticking with the mission and raising money for research to find a cure.
There's so much to learn in the fight against breast cancer. For more information, just head to the Family Matters section at KATU.com and click on the Think Pink icon. And don't forget to join us here at Waterfront Park Sunday, September 18th for the Susan G. Komen Race for the Cure. For K2 and Family Matters, I'm Deborah Knapp. Good night.